Thank you, Lois, and welcome everybody to this final happy hour of our autumn series. That we could be in Wales today, and we're going to draw attention to a spotlight on inclusion, as Lois has highlighted earlier. And we've got, as I said, 3 great presentations which look at different aspects of how life has been changed really over the last 6 to 9 months as a result of coronavirus, obviously, and how we've all coped with the pandemic, but also to capture some of the learning from what social inclusion, digital inclusion, and how we design for inclusion has an impact on our everyday lives in the way we manage and operate our housing for older people. For those of you who don't know about HAPPI at all, the term HAPPI comes from a report over 10 years old now called Housing Our Ageing Population, Panel for Innovation. And the Housing Lin has used that as a way, with COVID in mind, to become a mechanism to continue our in-person meetings, which now since March have become virtual. So the happy hour has been a regular occurrence over the summer and this autumn. And I'm delighted that this is our last one in Wales, because actually Adrian and I would normally hold a symposium at this time of year with all our members. So it's great to have you online instead. And we very much look forward to your contributions and chat and questions as we go along. So this afternoon, we've got, as I said, three sessions. I'm going to invite Paul and Alex and Brian shortly to join us. They'll be followed by Karen, who's going to look much more at the design for technology. And then finally, Andy from Qualitative Design, who's recently published a Housing Lin case study with colleagues from Link as well. So without further ado, let me invite Paul and Alex and Brian. So over to you.
Thank you, Jeremy. Prinondar, hello from Cardiff. Let me just share my screen. It's just having a brief think about it. Here we go. Hopefully you should see my PowerPoint appearing in just a second. Lois or Jeremy, is that showing?
It's almost there. It looks like it's just loading. It's okay. Let us know that you're sharing a screen. Oh, there it is. It's
yeah, great. Okay, thanks very much. So my name's Paul Willis, and I'm presenting today with my colleagues Alex Vickery, who's in the School for Policy Studies at University of Bristol with myself, and Dr. Brian Beach, who's from the International Longevity Centre UK and working with us on this study. We'd like to present to you today some of the initial survey findings and a bit of flavour of our qualitative findings from this study, looking at diversity in housing environments of care and support across Wales and England. Many thanks to Housing Lin and Jeremy for inviting us to present today. It's great to be able to share some of these findings, and we've tried to make sure findings have a Welsh flavour as well in fitting with the focus today. So what's the study about? It's about promoting social inclusion in housing with care and support for older people in Wales and England. We're interested in examining and identifying how housing providers promote inclusive environments across different types of housing schemes. So we've looked at schemes including extra care schemes, sheltered housing and independent living schemes. And as I mentioned before, we're collaborating with the International Longevity Centre UK, with Housing Lin, and 3 housing providers, one of which is based in South Wales and the other 2 in England. These are our research questions. This is what we wanted to find out in this 2.5-year project. The first question about, we want to just explore how do residents currently perceive themselves in relation to social inclusion and in relation to feeling valued in their home environments. What current approaches and practices do housing providers currently put in place to support and sustain the social inclusion of residents from minority or marginalised social backgrounds? How effective are these practices and approaches and schemes in recognising and valuing residents' social identities and diverse life histories? And how do residents from different social backgrounds experience transitions into these schemes and merge and forming social connections across the schemes over time. So those are the questions that have driven our inquiry. How have we been doing the research? We started our fieldwork in the autumn of 2019, so we've been running for over 12 months now. First of all, we started with a hard copy self-completed questionnaire that was completed by older residents across a large number of housing schemes in Wales and England. And Brian will talk more about what we learned from that questionnaire shortly. We've been conducting semi-structured interviews across 8 housing schemes, 2 of which are in South Wales and the other 6 are in England. And we've been speaking to staff involved in the running and management of those schemes, as well as residents who are currently living in those schemes. And of course, since March, we've included questions about the impact of lockdown and how that's impacted on residents keeping in contact with people within the scheme and also external to the scheme. And we've also had a series of longitudinal interviews. So these are a series of 2 to 3 interviews over 18-month period with residents who belong to specific protected characteristics or specific minority groups. So this includes residents from Black and Asian ethnic minority groups, residents who identify as lesbian, gay, bisexual and trans, may belong to a minority faith, or may be disabled and live with a disability. So we're in the last wave of those interviews at the moment, and we would have had about 16 people from those different backgrounds who have taken part in those interviews between September last year and December this year. Before we leap into our findings, what do we mean by social inclusion? How are we thinking about social inclusion and breaking this concept down? We've broken it down into 4 dimensions. The first in the top left corner is about residents' individual identities, their characteristics, and that could include protected characteristics under the Equality Act, and their own individual attributes. In the lower left quarter there, the second dimension is about the social environment within the housing scheme and the social dynamics within schemes, dynamics between residents as neighbours and sharing that space between residents and staff, and with people who are coming in and out of the scheme. In the third dimension, the top right quarter there, we're focusing on the built environment, the physical environment, the structure and layout and architecture of the scheme, and its location within a particular geographical area and neighbourhood, and how that shapes practices of inclusion or possibly exclusion. And the fourth dimension there is recognising the wider structural and political factors which will impact on the degree to which residents from different social backgrounds will feel included and valued and recognised within their schemes and within the wider neighbourhood. So that's how we've approached social inclusion. I'd welcome questions about that at the end of the presentation, but I'm now going to hand over to my colleague, Brian Beach, to present on the survey findings. Brian, do you just want to tell me to
yeah, that's perfect. Yeah, so go ahead and move on one. So so as Paul has highlighted, we sent out a hard copy questionnaire to residents with some of our partner providers in housing with care and support schemes across England and Wales. For those of you who work in the sector, you may know, I mean, particularly when we put together this study for in the proposal stages to the Research Council and everything, I mean, there was very little quantitative data that was fairly representative across the sector that could really give us a picture of what experiences across a host of domains were like for residents with housing and care. And so this was a particular knowledge gap we really wanted to address in this survey. So as has been indicated, so we've sent this out to residents with housing and care. We sent out just under 3,700 surveys to the 3 partner providers that we had, and these arrived to 103 different schemes. Our response rate was around 20%, which isn't very bad at all for this kind of exercise. We got 741 back from 95 schemes, and just under 22% were from people resident in Wales. So next slide, please. Now, as that indicates, we've got sort of about 80% in England and 20% in Wales. This was, the difference between the English and Welsh settings is a crucial question for us to look at. But the survey was designed to facilitate comparison with ELSA, which is the English longitudinal study of aging. It's a very comprehensive survey of representative of people aged 50 and over in England who live in private households. And it's, again, a very comprehensive, large survey that gives us some of the richest knowledge we have around the experiences in later life, covering lots of different modules. And the survey we created mirrored this so that we can make some comparisons that I'll discuss at the end of this presentation. But our survey roughly falls into these 6 different modules in terms of the categories of questions that we've asked. For the presentation today, I'm really going to focus more on those that you see on the right-hand side, so social networks, housing, and discrimination. Next slide, please. So again, because we're very interested in understanding people's experiences within these housing with care and support schemes, we've asked them different questions around their perceptions. And what I'm showing here are differences between the respondents in England and Wales across the 4 questions that we've asked, and I've grouped their responses according to what we would hope to hear. So the top 2 are very relatively positive statements, and the bottom 2 are fairly negative statements. So this is about the people who agree at the top and the people who disagree at the bottom. And so what you really see here is that the majority of people do see their housing setting as providing opportunities to socialize, so providing this opportunity to connect with other people and potentially therefore avoid aspects of social exclusion or loneliness. You do see a higher proportion saying this in England and Wales, which gives us something to think about as we think about whether or not there are distinct differences across the nations in terms of what solutions need to be or could be. On the bottom there, you see another indicator where we're hearing more of what we want to hear in the English sample than in the Welsh sample around finding it uncomfortable to attend social activities in their housing setting. But what's interesting here is that you've got a majority of people in England versus a minority of people in Wales. But those 2 there in the middle, I think, are what we probably want to focus a bit more attention on, because we're seeing less of what we want to hear. So there's a scope where about 1/3 of people, either in Wales or England, about 1/3 of them are saying that their setting accommodates their needs. And so I think that raises a very important question around the solutions that are introduced in schemes to create social participation and engagement. And perhaps there's a need for a bit better attention to making sure that offers match needs. Next slide, please. We also asked about experiences of discrimination, because discrimination is very easy to understand mechanism for driving social exclusion or limiting social inclusion. This is just around 5 different areas where we've asked people if they ever experienced some form of discrimination. And what I'll point out here is there are some differences in terms of the Welsh respondents being a bit having higher reports of experiencing these negative outcomes. But there's also, some of this is very subjective, and so it's hard to understand what we can do to change this outside of sometimes a broader cultural shift in attitudes, except for that top one, I think, is the most important in our context here, where we're still, even though it's a small proportion of people, only between, say, 12 and 17% of people are saying that they've experienced poorer service from doctors in hospital. This is certainly an area that we don't want to see anyone feeling like they're being subjected to worse treatment, because that has the knock-on effect, in particular with respect to health setting, that it could drive people avoiding health services in the future, which has a long-term negative compound effect. Next slide, please. besides getting a sense of people's own experiences of discrimination, we also were curious as to what they were seeing around them. So we've asked people if they've seen behaviors around sort of discriminatory behaviors or attitudes from staff in the housing and care settings or from residents. And here you see that there is there's quite a stark difference in terms of the absolute levels between England and Wales in both of these responses. I'll sort of come to reinforce it at the end. When you couple this together, I think the most important finding here is that the percentage of people reporting to seeing discrimination from residents is about 3 times that from staff, which again, I think is a positive message for the sector in that there's not huge levels of sort of discriminatory attitudes exhibited by staff, or at least perceived by the residents. Next slide, please. This is a really busy slide, and the only thing I'm going to point out as I move to the next one is if you look at those pink bars there on the right, this is just showing that there's a large proportion of people who aren't really engaging in writing, emailing, or texting. This sort of, again, this slide highlights lots of different ways that people engage in social connections and the frequency they do it. But those pink high levels of not really engaging in writing, emailing, and texting link to the next slide, please, which is around internet use. And here we see positive outcome for everyone interested in how things are going in Wales, where a relatively higher percentage of respondents are using the internet in Wales compared to those in England at 70%. And if you look at the devices that they're saying that they use, you see that we've got high levels of smartphones and tablets, which again, if we're thinking about what we want to deliver in terms of service, accessibility, this is useful to know that we're talking about things like smartphones and mobile devices versus desktops. Next slide, please. Now, as Paul indicated, we are very much interested in understanding social inclusion. We've done a lot of exercises in trying to understand the conceptual and measurement differences between concepts of social inclusion and social exclusion. But one thing I wanted to do, if you remember, I highlighted that our survey is designed to be comparable with the ELSA study. Part of this is because it allows us to build models that account for the similarities between respondents. So in a way, we can do analyses where we're looking at the treatment effect of being in housing with care and support. So in a way, we're controlling for everything else, and the only difference is where people live. And that tells us whether or not, in a really robust way, whether these environments are delivering on some of the promises around social inclusion and reducing loneliness, for example. So as one example of this exercise, what I've done is drawn on previous analysis looking at social exclusion through a social relations lens. So this work, their measure of social exclusion has multiple dimensions, one of which was around social relations. So this is essentially social relations exclusion. It takes on board a lot of the responses to several questions around social connections and partnership, for example. And I made a modified composite measure and to see the extent to which people are reporting or could be classified as socially excluded. When I've done this and I look at the sample for the whole survey, there's about 62% who are reporting who are socially excluded by this definition. And that compares to 47% for ELSA. But when I apply what I was saying, this matching technique that really starts to account for characteristics and differences, then the fundamental difference in the samples disappears, which indicates that that once you account for things that would influence social exclusion, it's not any higher in these housing with care and support schemes than in the general community. Next slide. And this similar approach I took with the assessing loneliness. So there's a standard measure of loneliness called the UCLA score, which ranges from 3 to 9. It's worth noting that the vast majority of respondents, both in our survey and in the ELSA survey, don't really report loneliness, so they score a 3 or a 4. And if you don't have a partner, then the lowest score you can get, the lowest score you can get is a 4 anyway. So that explains a lot of the 4 responses. But when we look at this measure, we see that there are similar proportions, but when you apply the matching technique and accounting for everything else, loneliness is on average lower among our respondents than it is in the ELSA community. Next slide, please. So taking this all together, some of the primary implications here is that there is agreement that schemes offer positive social opportunities, but there is, of course, scope to improve and make it less challenging or uncomfortable for people to participate in some of the activities on offer. We saw about up to a third are experiencing some sort of exclusionary pressure in the context of discrimination. But again, that positive finding really that a lot of the observed discrimination is happening seen in other residents rather than in staff, which says good things about diversity inclusion training policies. And then finally, the housing with care residents are not more socially excluded than similar people living in the community. And therefore, there's no sort of ghettoization as sometimes is feared or leveraged toward the sector. And in fact, it seems to be fulfilling its promise of reducing loneliness among residents. So next slide, please. This is my last slide. Just some of what we're going to be doing next and sort of have done in the past few months is furthering some of these analyses with the ELSA sample. We'll be putting together an academic paper, and then eventually all of the data for the survey will be deposited on the UK Data Archive for future researchers to use.
Thank you, Brian. I'd now like to invite Dr. Alex Vickery to briefly present a flavour of some of the qualitative findings from our interviews of residents.
Thanks, Paul. Thanks, Brian. I'm going to briefly talk about how Welsh residents have stayed connected during lockdown. I've worked on both the survey part and the qualitative interviews. As Paul mentioned earlier, we carried out semi-structured interviews with residents at 2 housing sites in South Wales, and we completed these in February 2020 before lockdown. So we decided to go back to these residents and ask them to take part in follow-up interviews over the telephone about their experiences of lockdown. And this included the 2 sites, extra care and independent living schemes. From these, we got 10 residents who were interested in taking part, and they spoke to us over the phone about how they've been coping and managing during the lockdown, and we wanted to find out how they maintained contact with others and how they stayed connected to other people, both in the scheme and outside the scheme. So every resident we spoke to, all 10, said that they had maintained contact through using the telephone, and they spoke to family, friends, organisations and other external contacts, mainly through phone calls, but there were a few residents who used texts and WhatsApps as well, WhatsApp messaging mainly. 4 out of 10 of these residents said that they had used Zoom and FaceTime and maybe WhatsApp video in some cases to stay connected to others. But as you can see from the quote, not all managed to use Zoom, and they gave it a go. So this lady said, I tried to do that Zoom, but I couldn't do it. She tried to do it with some friends that she has from school, but she just couldn't do it. So she decided to WhatsApp them instead. And there was a few residents who spoke about finding WhatsApp messaging great to chat and have jokes and send daily messages to their friends and family. Next slide, please, Paul. The importance of communal areas, particularly outdoor spaces, was mentioned by all the participants, and it seems that living in these schemes was beneficial to residents during the lockdown. They could go out and say hello to others from a safe distance, or just from from their doorways. Or in one of the schemes, there's a communal area which is like an atrium, which is kind of outside, having a glass roof. So they were able to meet at a distance out there because it's classed as an outside space. And there was residents who spoke about meeting outside in their communal gardens at a safe distance of 2 meters. As participant A12 says, she'd get a chair and she'd sit on the grass and have a chat with her neighbour, who was also a close friend of hers. And, you know, she says she doesn't know what she would have done really without that. I don't know what I would have done. And similarly in the independent living scheme, participant B4 says that, you know, you just walk around the building for their daily exercise and they could say hello at a distance, and that made them feel less isolated. We also wanted to find out how they were staying up to date with current events and what was going on in the country and the world. And 5 residents out of the 10 said that they'd been just watching the news on the television. And there was a few residents who said that they'd read the news on either their iPads or their phones also. Interestingly, 3 residents said that they had stopped watching the news, and this was because it became quite stressful and also quite confusing when the Welsh rules changed and they were different to England. Next slide. That's just a brief insight into what we found out from going back to speak to Welsh residents about their experiences in the last 7-8 months.
Thank you, Alex.
Thank you.
So that was a flavour of our survey findings and our qualitative findings. The study is continuing and is due to finish towards the end of July next year. And we're just in the process of wrapping up our interviews with residents and staff across the participating schemes. Please keep in touch with us by following us on Twitter, and also please feel free to visit our website. The URL is there to find out more about the project.
Well, can I thank you all for a really excellent presentation. I think, you know, bearing in mind the changes you've had to make in terms of the research methodology as a result of the pandemic, and the fact that you've managed to maintain the interviews as well as getting some really rich data is really useful and helpful. I'm just wondering, Lois, whether we have any particular questions yet in the chat box. I've just had a quick look. I've posted a few things generally in there, but there is an opportunity now, because I'm conscious that one of our presenters has to leave fairly soon. So if there are any burning questions or comments, please do either post or wave a hand so that we can identify you. But I just wanted to come back while we're waiting for that, just a couple of little observations. First of all, I think, Brian, I think you were trying to say this actually is a good news story on one hand. While there is a growing challenge around how to manage loneliness and isolation in our extra care scheme, the very fact that there is sort of planned and supported accommodation and a staff presence that contributes to reducing isolation and loneliness as well. So I was just wondering whether you could expand on some of that at all.
Sure. I mean, it's from a personal point of view, that finding confirms the same finding from a previous study I did. So it's always good when your results confirm each other rather than contradict. But I mean, it's, you know, it is hard to say what the drivers are in terms of why or what in the scheme is, you know, driving people to report lower levels of loneliness. That's precisely why we've got the qualitative side to this study. So we're actually talking to people about their experiences and can draw that out. But it is, you know, like I said, it's something of a bit of a robust finding here that, you know, I suppose the final thing I would say about it, one of the most important things about it is that this technique that I've used here, like I did in a previous study, it really it accommodates for all of the different things that are related to loneliness from an individual's personal circumstances point of view. So it really makes it a clearer understanding that loneliness is, you know, is lower than if you were to just survey them separately and compare the numbers, because I think, you know, we know that people enter housing with care and support for certain reasons that may increase their likelihood of being more exposed to some of the drivers for exclusion and loneliness.
Well, yes, and I suppose why I was interested on that, and I'm glad it's all reaffirmed, is because I think, you know, with COVID in mind, we have we still are seeing quite a high level of interest in extra care housing, perhaps as an alternative to other forms of care accommodation, in particular residential care. And partly that is because of the ability for schemes to offer both in the social interaction, despite COVID, but also I think as Alex picked up, the access to outdoor and other forms of space as well. So Alex, I was just wondering whether there's anything around that spatial element that you could sort of touch on from the qualitative work, which might also link into what Andy will talk a bit more about later on in the session.
Yeah, definitely. There was quite a few residents who spoke of how if they were living on their own in their own house or bungalow, for example, elsewhere, they would not have coped at all, and they really benefited just being in that kind of community space, even though they weren't always seeing residents of neighbours. They just knew that they were around, and there is the chance that you bump into someone at a distance and say hello, or just know that someone's along the corridor. So a lot of residents did speak about how important it was to be in that communal space, even if they weren't seeing them much.
Yes, and it sounded like in terms of following guidance around social distancing, personal hygiene, they were still able to manage and maintain their independence, irrespective of the confusion about whether the Welsh government or the English government or the Scottish government's guidance fluctuating all over the time, especially at the moment as well.
A few of them talked, a lot of them who did say about going out into the communal spaces, I don't think it happened straight away. Like it was after a month, maybe like a few weeks, a month, 6 weeks, when they started to feel more comfortable with being at a distance and, the rules. But yeah, I think that really benefited them being able to do that after that time period, being stuck inside by themselves.
Yes, and I think it comes back to what all three of you have said, how to look at this as a way of supporting people's well-being, but also their mental well-being as well, keeping people well, and trying to create that, and both create the social environment, but also the physical environment to enable that. Okay, so a really interesting point here from Gillian. I don't know whether, Gillian, you just want to say it in person. If you're looking at the chat box, Lois, do you want to unmute Gillian, or Gillian, do you want to unmute yourself?
Hello, can people see me? Because I can't see myself.
Yes, we can. Really good question. What was the point you want to make?
Yeah, the point was with the COVID interviews, the COVID situation really highlighted a tension between maintaining independence of residents and also safeguarding those who were shielding. So I think that was quite a difficult balance for some housing providers, and something they've never really come across. It's new, it's quite novel. Yeah,
that's a really good question.
We should say that Jill's part of the research team.
I am, sorry. I'm leading on the qualitative field work.
Right,
so,
of course, yes.
Yeah. So it's come out of the COVID interviews that Alex referenced during her presentation.
And Paul, Lois has said you had a question.
Sorry, I was just going to say on that, back to that point about the importance of communal spaces. Colleagues of mine in the school, Karen West and Elsa Cameron, did a small piece of research during lockdown, looking at the first lockdown, looking at older residents' experiences in extra care in southern England. And what came up from that was a very similar finding about the importance of balconies, the importance of having that space, which is still contained and distanced, but enables you to have conversations with your neighbours across balconies, enables you to participate in wider group events. And they found in their study, enable people to, for example, participate in a funeral service where they're able to stand out in their balcony and recognise and celebrate the passing of another resident, or another resident's life rather.
Oh, thanks very much. And I think that's I remember that study, and I think we've posted it on the Lynn website. We'll see if we can get it up and put it in the chat box. But I think the other thing was that, and this leads on really nicely to, what Karen's going to be talking about, is about, how operate from an operational point of view, how rapidly we've had to adjust to understand both those needs, both for those people shielding, but also older people per se, both in extra care shelter, but also those living in general needs housing. and the sort of their utilisation and usage of technology. So again, Alex, I thought some of the things you were sharing about the use of social media, and app-based technologies, as well as the landline, which became the default position, was really interesting. Are there any other things that you want to share before we sort of bring your session to a close?
I don't think so. I think it was important to have the telephone, but it was interesting to see how many people had actually given Zoom and other things like that a go. And Jill will say this, we've had also a few Zoom interviews with some participants, only a handful, but it actually works better than the telephone because you can see like we are now. And there is a few residents who preferred that to doing it over the telephone.
That's really interesting, and I know there's a number of people who've said, how much they feel more confident to be able to share a lot more information through Zoom than they probably would do in face-to-face as well. So that may be another research project coming out of this project. But I just wonder if I could just sort of, on behalf of everybody, just to thank you three for a really interesting presentation. So on behalf of the Lynn, a little round of applause to you. Thank you. So, Karen, I think we've set you up beautifully for the next session, which is very much our next order. Very much sort of looking at some of the work you've done, really pioneering around thinking about digital exclusion and inclusion. So, over to you.
Right. Okay. Can everybody see that? Yeah, okay, Fab. So yeah, thank you. That was a really interesting presentation. Hopefully this will follow nicely. So I'm just going to give a bit of an overview about a bit of a journey we've been on in one of our particular teams, but we'll bring in a bit of the stuff we've also included in our general needs work as well. So this is in relation to specifically our Living Well team. So this is the team that provides specialist accommodation support to our older tenants. Formerly known as our 50+ team, but we're very much trying to change our language and to implement and to reflect the changes of how we're working. So just give you a really brief background of what was happening before COVID, and then sort of an update that's happened since. So we really recognised that we were delivering a very traditional model of housing. So we had fixed staff on site, certain hours a day, with the tenants very much using the scheme managers for everything. So we had a lot of doing for people, and it was very traditional. So the team went through quite a lengthy review over a couple of years, looking at the service delivery as well as our physical assets. And whilst that took a really long time, there were some really key findings that came out from that weren't a surprise to us, I guess, but it was good to have had all the research that went in behind it. So some of the key things that came out of that review was around the importance of socialising and community to our tenants and feeling valued. The other thing that came out was the importance of our Connect project. And this was a project that was funded for 2 years through Comic Relief, that specifically focused on helping to facilitate social interaction between tenants, helping them to share their hobbies and skills, helping them to set up activities, and encouraging intergenerational work with the local community and engagement with the local community. So that was identified as an area of good practice. Demand for Wi-Fi came out of this from the tenants. We had sort of patchy Wi-Fi in communal areas, but access to that within flats wasn't possible. Improved physical space, the actual communal spaces and physical spaces was identified because we've got some quite tired properties. And then we also realised that the support we provided to our tenants wasn't equitable across all of the schemes. So we've got our traditional Cat 2 schemes where we've got a scheme manager on site, and then we had our Cat 1 schemes that were sort of more general needs for older people. So the level of support that people got wasn't equitable. So we after that review, went through a restructure at the end of 2019, and the team developed a really thorough strategic plan in terms of sort of future vision, and how to look at changes to the service delivery that we needed to provide a far more flexible approach across the board. And that was due to go live in March. And one of the biggest drivers behind the restructure was about making the Connect project core business. So rather than relying on funding through grants, that actually it should just become an integral part of what we deliver alongside our housing management services. So that was due to go live in March, and then COVID hit. And that, I think, really accelerated our thinking and our plans in terms of how we needed to do things differently. There were a few things we learned very quickly, one of which was that our data wasn't particularly great. So in terms of understanding our tenants' accessibility to the internet, technology, who was accessing services online, staying connected online, we just didn't have any of that information. So we realised very quickly that not having that digital connection with tenants was going to make things very challenging for us during the pandemic. And this was also seen in our general needs client group, because again, we just didn't have the information. And so essentially we'd had to turn to phones. So within this particular team, the staff in the very early days contacted all of the tenants, so we're talking over 800 tenants, to carry out individual assessments to try and figure out what the impact of COVID was having on them and how we could best support them. And the same was replicated in our general needs, where they looked at all the tenants over, I think they focused on over 70s because just the vast number. And then tenants were flagged to receive weekly, fortnightly or monthly calls from the team, because it was the only way we could figure out to provide the support at that time. And the thing we very quickly learned was that we needed Wi-Fi and a plan to support digital inclusion. And whilst that had formed part of our strategy, it was obviously a longer term plan. And what we realised very quickly is that we needed to try and start acting on this sooner rather than later. So the first thing we realised we needed to do was to get a really good understanding from our tenants of where they were at on their digital journey. And the only way we felt that we could do this was to carry out a digital survey, but to carry that out on an individual basis. So whilst it's very time consuming, and it has been, and we're still a far way away from actually getting it completed, we've had staff who have been phoning every tenant to ask them a series of questions and to have a conversation around do they have access to the internet? What sort of devices do they have? What do they want? What would help them? What's their experience been in lockdown been, etc. So we're only a quarter of the way through that, because I'm sure you can imagine having those sort of surveys with 800 people in person, over the telephone is very demanding. Through which, because of the isolation, the conversations go into far more depth around their personal situation and support needs. But so far, what we found with the tenants we have spoken to, so 57% have said that lockdown would have been easier with internet access or access to technology. 37% have said they were interested in being digitally supported or interact with our staff digitally, and 40% interested in training. So I think for us, that's given us a really positive start in terms of getting a feeling for where our tenants are. The reasons why tenants aren't engaging with us digitally, I don't think any of these will be a surprise, but the comments were around devices being too expensive, that they don't know how to use the internet but would like to learn. They don't use the internet because it's too expensive. Some said they don't want to learn. I think we need to do some more in-depth looking at those tenants that they don't want to learn because there's particular barriers, or they don't see the benefits of being able to access the internet, not being able to keep up with technology, capacity to learn, and then site problems came out a few times as well. It's been really interesting to start getting that really individualised feedback from tenants, which is now helping us to move forward. So where we currently are is our exec team have signed off the installation of Wi-Fi in all of our Cat 2 schemes, so the schemes with communal spaces and sort of more of a scheme manager presence, and our extra care schemes, and that's going to be installed at no cost to the tenants, and that installation is going to start ASAP, because whilst COVID is still with us and we have to be really careful how we manage that, what we can't do is wait until the end of this, because that could be, obviously several months or even years. So the installation is going to go ahead in a COVID safe way. We have agreed to fund the costs of then the service for the first 12 months once it's installed. And our hope is with that is that we can then spend that 12 months working with tenants to really understand what they need to become more digitally included and support them to access the technology, you know, for a number of reasons. So we're hoping that following that 12 months, they will see the benefits and will sign up to the provision of Wi-Fi, of which it will cost them around £2 a month. So it's really, really affordable in terms of if you were going out to a commercial provider. We've recruited a 6-month post to support the area of work. You know, we've realised that these surveys are really time intensive because it isn't just about having the conversation about the questions we want to ask. And what we then want to do is properly analyse that information to then start looking at developing an action plan for moving forward. So I think it's fair to say that we're at the very start of our journey, and there's an awful lot of work to do. Likewise, within our you know, general needs accommodation, you know, we're looking at how digital can be a default, but again, there needs to be an awful lot more understanding around tenants' access to the internet and technology. And we have had a couple of pilots where we've installed Wi-Fi as part of a new development. So we're doing a piece of work around analysing how people are using the internet with that to help develop that piece of work. So in terms of next steps, and I say this is early days for us, but what we want to make sure is that we're using the Wi-Fi that we're installing to the best of our ability to deliver the services. What we don't want to do is just put Wi-Fi in and not know if it's made a difference to people. So, you know, really thinking about what it is we're hoping to achieve with it, what the outcomes we are going to be measuring, and that will all come off the back of the information we get through the digital surveys. Our aspiration is that all tenants will have access to a digital device. And again, we've been having conversations around what that looks like, and that might be us providing it to them. You can get some really reasonably priced technology now. We've talked about the option actually as a basic. When somebody starts a tenancy with them, we give them a device and set them up with that, and that's, you know, we install all the relevant information that they need to know in terms of their tenancy, etc. on it, and we actually do the work so that they know how to use it. For tenants to be set up to access transactional services digitally, so we have a tenant portal that isn't particularly well used at the moment across the whole organisation. So we're doing a piece of work to revamp that. But the idea is across the organisation that there will be a portal where tenants can report their repairs, report ASB, pay their rent, etc. But where we can also push messages through, and it can become a portal for communication between tenants and staff, and aid communication a lot better. You know, through COVID, I've lost count of the number of letters we've sent out where we're trying to get information out to people, and actually letters is one of the only ways we've got, because we don't understand how people are connecting with us digitally. So the idea is that digital will become part of the norm for our new tenants moving in, right from the application stage in terms of utilising the portal and communicating with staff. But we also recognise we need to go through a transition with our existing tenants, and the individualised support based on the survey will really help us with that. So because we're doing the surveys on an individual basis, we'll be able to really drill down into what support people are going to be able to need to move over to some of the accessing some of our services digitally. Looking at training and digital inclusion activities for tenants. And also one of the key things for us that we've really clearly obviously seen through COVID is supporting tenants to access those platforms to speak to friends and family and stay connected. We do feel that by going down this road and putting infrastructure in place, as well as the support and training, we'll be able to move away from staff being set at schemes, which will then mean we can deliver some of our support over digital platforms, to hopefully mean we can reach more people. As I said, you know, we find we've not got an equitable service across our tenants, so actually it should enable us to provide more support to more people, you know, without the need to have staff in set schemes or spending a lot of time on the road driving between schemes, and will also then enable us to focus face-to-face time where it's most needed. So for those tenants that most need that time face-to-face, then we can do that. We also want to create digital community to support the social interaction and connection between our tenants, and this is about building on the Connect project and sort of forming a digital Connect platform. You know, because I think whilst it's been amazing having the Connect project, and they delivered and developed a huge number of activities in the communal spaces and in the community, there are also a number of people that still don't feel they can access those for whatever reason. So actually having another platform where people can engage, I think, is really important to us. And then really important to look at supporting the introduction of assistive technology to enable tenants to stay in their homes for longer and potentially reduce the demand on social care. We've got some pilot projects where we've installed assistive technology in step-up, step-down flats, where it's had a really beneficial impact in terms of people either being able to go home and also really reducing the level of social care that's needed. And just something as simple from reducing, you know, a 2 care visit to a 1 care just improves people's dignity massively. So, you know, that for us is really important. And looking at including assistive technology as part of our design features in new schemes. As we move forward, as I say, we recognise we deliver very traditional services. Our schemes are very traditional. So it's looking at how we can utilise digital technology, assistive technology to help in the design of our new schemes as we move forward. And also then environmentally, you know, upgrading our heating and energy systems and using smart technology and seeing how, you know, that can obviously have a massive impact. And again, that's something that goes across all of our tenancies. So that's kind of the journey we've been on, I guess. It's a real whistle-stop tour. We are very early on in it, but really positive and passionate about the fact that this could make a real difference. And I think for us, the fact the organisation is committed to the installation of the Wi-Fi, you know, gives us a real platform to jump off with this. But I guess, you know, the ending note is we acknowledge that digital won't work for everybody. So we always still need to have an alternative, you know, so we don't want to push everybody down this route. It's about us working with our tenants and going on the journey together, and where digital works, it works, but we acknowledge it won't always. So that's a whistle-stop tour.
No, that was fascinating and fabulous whistle-stop tour. It really builds on, I thought, very neatly from the previous slides as well. So a really good segue. And what struck me really was how you've looked at this, and I know you're still early on in the journey. You've looked at this very much from a tenant's perspective, and, you know, building services and other aspects, that interoperability with social care, design, heating and energy, that building management stuff to come. So again, we very much look forward to following this journey with you, because what you'll know from, you may know, is that to parallel some of the work we've been doing on HAPPI, we're coining a term called HAPPI, which is looking at technology and the integration of that across housing and health and social care. And what you've highlighted is very much at the heart of what we think is a really good approach to integrate with residents at the centre. So I know you're early on, but it's really fascinating, and thanks ever so. Lois, can I just ask if there are any questions or comments, because I'm conscious that Karen needs to leave at 5.
I think Adrian, you've got your hand up. You unmuted yourself.
Yeah, just one quickly, Kath, not to put you on the spot at all. Just what interests me, I think firstly, just remarkable progress on your Connect project anyway. So just to say well done for that. So I heard it very early on. You mentioned about the acceleration of pace of change. Certainly COVID has pushed us all down that road. And we're all doing things now perhaps we wouldn't have thought we were going to be doing 6 months, 8 months ago. Just a couple of quick things. I mean, around the connectivity, but more I suppose to do with you've got the 12-month buffer in place really in terms of putting the Wi-Fi in, installing the schemes. It's the service charges or potential cost to residents coming out the other end. I know you said it'll be marginal, but generally speaking, affordability is an issue for us at the moment, particularly with service charges generally within sheltered housing. I just wondered really in terms of whether you've had any consultation or discussion with residents about that, or is it still a bit too soon, perhaps?
Yeah, it's still a bit too soon. I mean, I think we've had the discussions with tenants in terms of how much they value and really want the installation of Wi-Fi. That's become very clear. I think for us, the affordability of looking at what the costs are going forward, there isn't anything comparable out there. There will be a need for the consultation. We haven't done it yet. I think for us, the challenge will be with what happens after that initial 12 months and what's the uptake like, because if the uptake is low, obviously the costs increase for people. So, so our efforts really are in that 12 months of really demonstrating the benefit of it, because, for the costs associated with it, £2, but, it will have to be an opt-in or opt-out. But I think, after that consultation, the discussion will then be internally is, well, how many people are opting out? What does the cost look like? And is it something that we want to subsidise and manage? Because actually this agenda is really important for us, especially as we're looking at, as new tenants come in, that digital journey being there right from the beginning. So our challenge is going to be with the existing tenants and how we look at the transition. So yeah, it's going to be an interesting period of time, that consultation.
Well, thanks for being so open and honest with us as well, because I know you're still very early on and still formulating that. I mean, I know from other parts of the UK that we've seen people thinking about developing virtual extra care. Now, you're not talking about replacing on-site permanent staff, who need to be there 24/7 and extra care. But it does mean you can think differently about how you manage your buildings, how you manage your tenant services. And what I got very early on from what you're saying is about both the information sharing that you're able to do, but also supporting the interactivity and the interactions and some of those social networks, which touch again on what Brian, Paul and Alex were talking about earlier. So on behalf of us all, can I really thank you? And I think, unless we have any final questions, I think one of the things you touched on is about your future design. And this again may link in neatly to Andy about designing for technological inclusion. Cat 5, Cat 6 wiring was something we all talked about 5 or 6 years ago. You may have a view about how we take some of this on, and do think about it as part of your presentation, Andy. So, Karen, thanks again.
Thank you.
Andy.
Okay, so Jeremy, thanks very much for inviting me along this evening. I'm Andy Tansel, Qualitative Design Architects, and we were very lucky to get 2 commissions, I think starting back in 2015 with Link Cymru, one at my steg and one at Tondy, both similar and also both unusual as far as the work that we've undertaken in the past. That is that this building not only accommodates extra care, it also accommodates residential care. Bridgend needed a number of bed spaces after closing down some of their old, not fit for purpose properties. And at my steg, they have 10 bed spaces, and at Tondy, they have 15. However, it occurred to us that during the lockdown, it would be worth looking at a building we designed to see if it, sorry, my light's just gone out. It will come on in a minute. Worth looking at how our buildings stood up to the COVID crisis. And if I just move on there. Sorry, I'll move it away. So I'm just going to focus on the My Steg scheme. Tondy is very much the same and actually has very much the same outcomes. Tondy opened, I think, at Christmas 2018-19 and My Steg mid-2019. And just to set the scene, it became a community hub. The building was built on an old school playing field in My Steg, and we looked at the extra care first, and then Link Cymru looked at options on the rest of the site, some of which was general needs. But it ended up us building 17 1- and 2-bedroom bungalows, and it's become a hub for to grow old in effect. So the hub was very much centered around the kitchen, the cafe, the dining room, lounge, and the kitchen garden. And it also, the kitchen was incredibly popular, as it normally is in extra care. And they were often getting people from the residential care coming into the kitchen lounge area, also people from the bungalows and from the neighbouring streets. So it very much became a hub. Move on. I can get the next slide. Sorry, it's spooling at the moment. So this is just a brief breakdown of how the building was made up. So this is the ground floor. Here are the 10 residential care bungalows. Oh, sorry. 10 residential care units en suites. This was future-proofed, as you can see. The sort of wall in the middle was just a lightweight wall built to give us the acoustic requirement. But in effect, that's a one-bed apartment in plan shape. So the ground floor was split up with the residential lounge dining space here, the 10 units in this location, assisted bathroom, and then the nurses station in this area with a laundry just to the rear, and that's the lift there. In this part, we had the communals for the extra care, starting here with the refuse and the buggy store, the access from outside to the kitchen in that location, main entrance here. Notice the double lobby doors here because that's relevant later, and then the lounge and dining space. And then that's just the extra care unit on 2 floors above, giving us the 20 apartments that were sought. This is the site, so just in essence, that's the extra care location there. This is the main route in from the Bridge End Road, and the bungalows were the first properties that you came to. You swung around into the car park of the extra care. Here we had the gardens in this location. You can see south is coming across Bridge End Road, so we got relatively decent garden areas to the front here, and these bungalows looking east and west. So that was nicely set up, up until March of this year, 2020. Everything was going very swimmingly. This was the sort of thing that was happening in the lounge dining area at the time. Activities for everyone joining in. I mentioned dear Mark Drakeford, who gets blamed for an awful lot at the moment, gave us the lockdown and the dangers posed by the COVID-19 virus made it the residents very vulnerable. So we thought it was worth then Jeremy and I interviewing the management of Link Cymru to see how it was with them in this unit. This was just during lockdown in July, so it was sort of coming out of that. I mean, at that point they had the deserted lounge areas. No one was getting their hair cut or trimmed or permed, and the main street was completely deserted. So we had to think how we were going to how our design might have stood up to the COVID crisis. Of course, no one had ever thought of this, and it was really, I think it's been really interesting for the previous 2 slide versions that we've had today, that how closely interconnected they are, and how interested I am in what you've done and how that might be applied to this building. So we've only really looked very superficially as a design over the building, and then there's all you scholars, I would say, who's looking at those crunching figures, bringing it to the fore, and what actually residents would benefit from totally across the board. So the design is obviously just very much one small part of this. So as I mentioned earlier, there are two service managements in the building. One was Bridgend, one was Link Cymru. And Trudy Davis was the scheme manager for both schemes, along with other schemes for Link Cymru. And Richard Sheehan was also managing right across the board for the extra care and elderly living in Link Cymru. And they kindly gave up their time just to go through and to have a sort of bit of brainstorm about what actually is there about this building which is good, what is there about this building which really doesn't work for them under the COVID crisis. I mean, in general, we did receive fairly positive feedback from the two parties, and they, at the time, that was in July, could report that they didn't have any COVID, they were a COVID-free development, and they felt that was largely down to the staff regime and the ability to make best use of the building. So the building allowed the management to keep the residents very segregated throughout. Obviously, this is something that Jeremy touched on. Does extra care give management the edge? I'm not absolutely sure, because we have both in this building and they both don't have any instance of COVID. But maybe on a larger scale, and we have heard some horrendous situations in care homes throughout the country. You know, you just have to take your hat off to the staff who had to endure some of those conditions. However, during lockdown, they were able to keep their residents entertained with a series of activity packs, good communications with on-duty staff. I mean, it's interesting to know whether Karen and Alex could look into this, I guess, with Link, because I don't really know. Trudy said good communication. I don't really know what that means and how many of the people there actually have Wi-Fi. You know, what sort of communication do they have? So that would be interesting to understand. One of the main features that Trudy pinpointed, and you just wouldn't have believed it normally, is the double airlock doors that you have and the fact that you can keep them closed, because trying to keep residents out and relatives out from the building to see residents was probably their main preoccupation, because people, when these doors are open, would just walk in, and that's the last thing they really wanted. So they had to provide a very strict regime for the relatives, and it was by appointment only, and then it was just they weren't let in. So technology in that instance had to come to the fore if people were going to communicate. So during the pandemic, everybody had to stay in their rooms. They weren't allowed out into the communal spaces, the lounge or dining room, but they were allowed outside on a rota basis. And although we had a pretty good summer, I suppose occasionally it did rain. And on this particular scheme, for reasons that, you know, an architect might think about, wouldn't it be nice to have a covered area outside the lounge? This particular scheme allowed that to happen quite nicely. It's just the fact that you may just be able to see in the background here that comes off the main dining space to the extra care, and then there's a little canopy this side for the residential care. And the fact is, we have these side windows, so you can let light into those spaces from the side, whilst not overshadowing too much from this being the south side, not overshadowing that space, but it can get light from the side. So that sort of gives you the best of both worlds in a way. So that truly was a godsend, because she could allow people out quite comfortably into this the rather spacious garden. They would do it on a rota. There were obviously strict instructions not to get any closer than 2 meters to each other. And, that worked very nicely and gave everybody that little bit of breathing space during the day. So I'm just going to move this. So here are the real heroes of the scheme, the staff providing the food. So obviously if staff had to stay in their apartments, food could only be delivered on the hot trolleys and trolleys during the day. And these are the people that delivered and they were in full PPE whilst doing it. So, it's hard to think what they must have endured during those months through the summer. So obviously things petered out as far as COVID. Everything seemed to get better. The R number came down below 1 and we were all starting to be allowed out. So I asked Trudy a week or so ago, how were things? And she wrote back, this is on the 29th of 10th, 2020, and this is in her words. She said, here's a little rundown of what's been happening since we last spoke. We've continued to keep all residents and tenants COVID-free, which is a blessing. We reopened the restaurant, this is prior to the recent lockdown, with social distance tables and chairs, and put 2 sittings in for lunch, which was working really well. The tenants were really enjoying seeing one another and eating together. That was short-lived with the new fire break, and we're back to serving lunch to all apartments until further notice. Just gone a little too far, sorry. And now under the fire break, they're not allowed to allow anyone back into the building, which includes the residents of the bungalows. So that's been really difficult, and that was something I asked, having lost that social hub, that social space, how are those people coping? And they are providing a welfare check on those people in the bungalows, so they're doing well also. So going back or on to allowing visitors and families into the scheme, they will only do that in end-of-life situations or where there's emotional well-being involved. They cannot do any activities in communal areas. They're keeping them entertained with paper quizzes. I did notice actually online, there is a company that now, well, I'm sure there are loads of companies, there's one in particular which gave a whole menu of activities that they've got in preparation for elderly care. So I did have it in my mind, but I've forgotten what it is, so I can let Jeremy know later. We also make sure that everyone has supper. So I think they've extended the food delivery in the development. So everybody has supper, toast and cereal for breakfast. So there's no change with residential as they're all in one bubble. Again, she refers to the fob-activated doors, extremely helpful, and keeping family out with these doors, so they have to drop everything off at the by-parting doors. Whoops. I hope that helps. Let me know if you need any more information. So, I mean, all I can say is I thank Trudy Davis and Richard Sheehan for taking the time out to provide us with a window on what is quite an uncertain world at the moment. And I just wondered if everybody today, if it wasn't worth providing for the Housing Linn their own experiences, either be in their Cat 2 developments or extra care or residential, whether they can add to what I've just touched on, really. I'm sure there's an absolute sort of mine of information out there that we could pull together because, as we know, this doesn't appear to be going away anytime soon. And I think, it would be good to have some sort of paper that could be given to management to allow them really to just have a sort of tick list, a very quick paper that they could refer to whilst trying to brainstorm how they could deal with their developments or improve them. So thank you very much.
Andy, sorry, I was just unmuting myself. Thank you very much for a really interesting presentation, both looking at some of those design features, but also an update, which is really great to hear in terms of managing, albeit having to sort of implement the fire breaker on the scheme, but also to support and safeguard residents there at the same time, and that tricky balance. Lois, do we have any sort of comments or chat questions in the chat box? No, I mean, all I wanted to add is please do show of hands or use the or do wave or digital wave. Andy, I mean, in terms of the design and the use of the space now, you showed some of the pictures of the drawing of the scheme in terms of the spatial elements. One of the things that we've noticed is that actually extra care housing and to a certain extent larger sheltered housing scheme and retirement villages, they are able to manage infection control and also look at the use of social distancing because of larger communal spaces, but also managing entries as well. So I just wonder whether you've had conversations with any other clients or customers about the redesigning or repurposing some of the existing schemes, because I'm conscious that you as a practice have also changed entrances, Dora Matthews' house, for example. Would you think something differently about that now with COVID in mind?
We are designing other schemes at present. I have to say, surprisingly, our clients aren't asking for anything much different. I mean, the one thing I guess, not looking at the entrance, one thing we have looked at is really possibly segregating the sanitary facilities between staff and residents. So just trying to reduce on any cross-contamination or opportunities for the virus to be cross-contaminated, so that there are designated staff facilities around the building, so they don't have to go travelling back to the ground floor when they're working on the top floor. So that's probably, I would say, the only thing that we've really looked at that differs at present. Trudy did say, so one of the negative things which I didn't mention is social distancing in offices and the like. The office that we designed was far too small. When they get two people in there, they couldn't really social distance. So that needs to be thought about. It's always trying to, in the situation, trying to keep social distancing in mind.
Yeah.
I think that's probably what's come across.
Yeah. But I think the other thing which shows for us is that, albeit some of what you've just described in the case study and the presentation is very much a blend of extra care and residential care, actually independent living apartments where you can quarantine, self-isolate, manage social distances work well. And you said, would we be willing to sort of collate examples? By all means, we would be very happy to do so for two reasons. One is that we've worked with others to update some of our design guidance on designing extra care, and also on our design pages on our website we have a wealth of information on COVID now, and we're always looking for latest policy and practice on that. So this is an open call for anybody to share, and I know that we've had I can see Jean from Arcadia on the call. I know we've had colleagues from hers sending us some ideas that they've had around design and followed her on social media as well. So yes, please do, and we can put a call out in the coming weeks for that. The other thing just to share before I pass over to Adrian is to say that we're in conversation with a large national charity, and it's not Sarah who's on the call, but the St Monica Trust, to put a proposal in to think about how our sheltered housing, retirement housing and extra care, how have they coped with extra care? And we're really keen to survey the sector on this, and we hope we may get some positive news on how we might be able to fund that in due course. But I know that there's been a parallel and a sister piece of work with Leeds Beckett University and the National Care Forum looking at these very issues in relation to residential care. So Sarah, if you want to make a point about that piece of work I think you were involved in, please do. Otherwise, I'm going to draw this to a close and thank everybody for their presentations. So Andy, thanks a lot. Thank you. So Adrian, I'm going to leave it to you unless there's any final questions in the chat.
Thanks, Jeremy. No, just by way of, I suppose, wrapping it up, just again, thank very much the speakers for stimulating presentations this afternoon, and all the tied in very nicely, I think, as well, as if we'd planned it, I suppose, Jeremy. I think that was it's all in the plan. Yeah, but thanks, Paul, Alex, and Brian, particularly the first presentation with the DICE survey. Look very much to see the outcome of that eventually when it's published. Karen, who's built on the Connect project in particular, which we heard about before, but just to see how much accelerated pace has moved on with that, I think, since we last spoke. And Andy as well, I think you've just given me some views and thoughts really around our category 2 schemes, in particular about redesign and looking at that through the lens of COVID, really. So really stimulating. So thank you very much for all the speakers. There's a couple of things I think just to mention. I know the slides, there's been a couple of questions in the chat room. I think Lois has the slides, and obviously this has been recorded, so that'll be made available for everyone, so to be able to pick up. Obviously, I need to thank Lois very much for organising and facilitating this event, and obviously Jeremy as well. But I suppose just to say from the Cymru's perspective, this is instead of our symposium that we normally have. We've had now a few happy hours. I know this is the last happy hour of the LIN this current year. So we do welcome your feedback and more wider feedback on how they've gone and whether they're formats that you enjoy. And obviously the information exchange and the snappy nature of these kind of things keeps it all real for us. But we'll obviously be planning for the new year, and we look forward, I think, to a situation where we can blend the virtual with meeting in person again, I think, as things unravel, really. So thanks very much for for the speakers again. Thanks very much for the contributions we've had, and certainly this won't be the last of the debate we have on these subjects. So again, just I suppose to wrap it up, to say thanks very much, and stay safe, everyone, and enjoy, if we can. We don't speak to you before what will unfold at Christmas. Nostra.
Bye, everyone.
Bye, everybody. Thanks for joining us.
Thank you.
Bye. Thank you.
Bye, guys.